Great. Thanks, Yelena. I want to thank everybody for joining us on the webinar. Hopefully, through the end of this, you'll learn a little bit about just financial tools and then how to structure whatever type of healthcare organization you have as far as the financial reporting to get you what you need to manage it effectively. The agenda I'm going to kind of go through a little bit. I'm going to go through the healthcare today, just kind of a real quick overview of what I think the industry is facing now and where it might be headed. I'll parlay that into just talking about how to manage and what are some things that we've seen in our experience where we found people to do it very effectively and where we thought people may be in short on just how they manage things and the tools they needed and the financial reporting that they had for that. At that point, I'm going to turn it over to Philip, and he's going to give you a quick example. So some of the stuff we've talked about or I've talked about in the first section, Philip will show you some tools so you can kind of see what that might look like. So that's the idea behind our presentation. A little bit about myself. I've got 32 years experience in the healthcare industry. It means I'm old. 3 of that I was actually in the industry. I was a CFO and an interim CEO. As an auditor and a consultant, I worked in the Nashville, St. Louis, and Lexington markets. And so I've worked with healthcare clients all over the country. I've worked with hospitals, small physician groups, large multi-specialty groups. I've worked with long-term care providers and actually a lot more. And I've worked on a lot of different types of projects. I've worked with the mergers. So I've helped physician groups merge. I've helped physician groups merge into hospitals and hospitals merge into hospitals. I've done some strategic planning and operational improvements. And so what that's allowed me to do in all aspects of that is just to look at the financial reporting that these organizations utilized. And so I've seen a lot of really good examples, and I've seen some that were bad. And it wouldn't shock you that the ones who had bad financial tools, financial reporting tools, were the ones who were in most trouble and seemed to be always trying to dig out from a hole. And so that's part of what this presentation is about, is to try to avoid that for you all. So here's a summary of what I've learned. I think the beginning of failure of most organizations that we worked with was a lack of solid understanding of their financial situation. They just never grasped where they were, and it wasn't like it wasn't there for them, but they just never quite understood it. Or they failed to understand what trends were happening. So they might be able to tell you their position today or their position last year, but they couldn't see what trend was coming at them. And this was never like a fast issue. So times where I've gone in to help organizations retool or try to dig out from a hole, it wasn't that something hit them hard they had to deal with. It was instead just a very slow failure to identify issues over time. The other thing that I've learned is typically in healthcare, it's not uncommon that an organization may talk more about its cash and its cash flow versus its operating results. And sometimes they'll talk about their operating results more than their cash position. And it's usually too much attention is given to one or the other, but not both. And as most of you on this call probably realize, is you've got to talk about both things. I mean, it's not just cash and it's not just operating results. You've got to be able to look at those two things simultaneously and what impact that has. And so I've seen where organizations over time just don't do that. And so that's something that I feel like should be better as you guys do your financial reporting. Healthcare today, it's not a shock to anybody on this call, but change is happening. And obviously that's not a new thought or an original thought, but it's coming. And it's not linear, it is exponential. And so each year we are dealing with more and more change, and it impacts everyone in healthcare. When my career started, it was not uncommon for people to talk about the fact that the healthcare industry was insulated from the national economy as a whole. That when the economy would go into a recession, healthcare didn't really feel that because it was insulated in the way that it was managed, in the way that it did, and how the payers worked. So it was actually nice from that standpoint. Unfortunately, with the advent of the high deductible plans, that's no longer the case. And so healthcare deals with recessions just like every other industry does. That's just one example. The fact that healthcare costs continue to go up and it's a bigger part of what employers pay, they're forcing change on us. And so today, I've got clients who have direct contracts with employers. I've seen employers go and contract for specific services with specific providers and had all of their employees go that direction for that one item. Wellness benefits continue to increase as we try to get employers to minimize the cost. And that's all before we consider the technology changes that's facing us, not just in the delivery of care, but how we access that care. My daughter-in-law just 2 days ago talked about the fact that she gets one free tele checkup a year, and so used it before the end of the year because she wasn't feeling well. 15 years ago, 5 years ago, 10 years ago, you would never thought about something like that. And so just changes coming from every different aspect. And sometimes what that does is it makes us stop to question what it is we should be doing. When we're sitting here in an environment where there's so much change, we lose sight of the fact that even and in spite of and along with the change, the basic things that we need to do as far as financial reporting are the same. And it doesn't matter how much some of the changes are occurring, we still have to kind of do the same thing. And so I think that's important to realize. There's still consolidation in the industry. The smarter providers, the larger providers are starting to look at not just consolidation, but diversification within the healthcare field. And so we're seeing more along the lines of, again, the hospitals and the physicians and multiple different types of relationships between those, but other types of providers getting merged in with hospitals so that they're kind of an all-encompassing provider for a population of patients. Consumerism, I mean, just the fact that patients now are coming and they're I hate to say it this way, but in a lot of ways they're a more intelligent provider or more intelligent purchaser of healthcare services. And that's something that a healthcare entity never used to deal with, and now you have to. That patient understands their options as far as where they could go for healthcare, and that's a big thing. We've been hearing this for a while. I'm seeing it more and more, but this emphasis in the value as a driver in reimbursement and not just the results, and so or the procedure. So you kind of get away from the volume and going to value. That's becoming a bigger and bigger part of our clients and how they get reimbursed. Talked a little bit about technology already, and just digitized medicine, wellness products, etc. One trend that I think is going to hit us sooner rather than later, and this is this concept of big data. As patients, we've had for years now all of our health records digitized and stored, and that information is out there. It will not take long for someone to be able to access that data and help us from a health standpoint. Making sure that we're doing the screenings that we're supposed to do, when we're supposed to do them, making sure that if we have certain conditions that we get certain treatments. The use of healthcare data will start to drive a lot in the healthcare world soon. And I believe the cost structure and the increase in costs are going to force it. So someone will develop those tools sooner rather than later if they're not already doing it. And to me, the next generation of patients is a whole nother ballgame for those of us who've been in the healthcare world for a while. The next gen patient is going to want to access our services at a much different way than what we've done historically. And that'll be something new that we'll have to come up with, and new that we'll have to adapt to. So those are some of the trends that I see happening. And again, that's a lot of change. And as you think about the job that you have to do to think about change coming down the pike, along with what you have to do on a daily basis, it starts to get a little bit overwhelming, or it can. But you've got to remember that the things that you have to do from a financial reporting standpoint are still the same, despite the trends that are happening. And so to me, tips in this is you need to understand what information that you need in order to manage your practice or your organization or your section of whatever healthcare entity you might be part of. You also need to develop metrics that gives you insight into your organization. You're going to hear me probably say this a couple of different times, but the day where you could look at a set of financial results or even just cash reports and try to manage something from that, that's long gone. you need to understand the metrics or key performance indicators that will help you drive to a deeper level and be able to tie financial information from a reporting standpoint into those metrics to help you make the right decisions. And then you have to make sure that you've got the ability to identify trends. Life is changing, the world is changing about us at a faster pace. No longer can you wait 3 months, 4 months, 5 months to react to a trend. You need to be able to get on those things much faster. And so you need those tools available to you. And I'm going to go through each one of these in a little bit more detail next. And so to me, there's certain pieces of information you absolutely need. I mean, you need to understand your financial results. And when I say that, it's the basic P&L. It's your profit and loss statement, income statement, whatever you may refer to it in your organization. You need to understand how it is performing financially. When you take a look at your revenue, the actual collections, and all of the costs that you have to cover, what's the bottom line? Is it a profitable result, or is it losing money? And you should be able to look at those results by either location or by segment or by provider or by subsidiary. And you could go on and on with the different options to be able to look at your financial results. And so that's a cornerstone. I mean, you just have to be able to look and say that's a reliable set of numbers, and this location is losing money and that location is profitable, and I can try to then understand what's the difference between the two. The financial results and the information that you get should also be flexible enough on how it's reporting depending on how your organization changed. We talked just a few minutes about the changes that's coming. You need to have a system that is somewhat flexible so you can change and modify how you dissect the information. Just a stagnant reporting in the way that it's always been done, my concern would be you will not be able to identify trend or to calculate the metrics that you need to look at in order to make the right decision. So to me, financial results you have to have, and the reporting has to be flexible enough to allow you to change as your organization changes. And again, to add a location. I've seen healthcare entities been one location for very many years, and all of a sudden it adds another. Well, it needs to all of a sudden add, and it was so difficult to do that because they couldn't allocate costs the right way. And so that second location always looked like it was very profitable, which it wasn't, but no one knew that, and no one had the decision-making ability that could see that and then make the changes that they needed to. So flexibility is huge. The financial results, you should be able to look at them into different time periods, by month at a minimum, then obviously year to date, and they should also be comparative. We talked about trends. If you do not have it from a comparative standpoint, you will never be able to identify the trends that we've talked about. And then I've got this point in here, you should be able to look at the results from different perspectives. So to me, it's like a drill down. So you should know where the organization as a whole, how it's operating when you look at financial results. You then should be able to say, well, let me look at it by provider, or let me look at it by location. The more powerful tools that you have will allow you to do that, and then almost if you think about a sculpture or something that you get to rotate. And your view of that thing is much better if you can rotate it and spin it. That's the same with financial results. The ability to look at it from a different perspective allows you, as someone who needs to report on a financial basis or is making decision based upon those, to make a more informed decision and a better decision for your organization. And then lastly, you should look at key performance measures at consistent intervals, looking for trends. So make sure you're looking at it at the same time period all along the way. And that seems to be common sense, but I've seen organizations not do that. And let me kind of pick that last point apart just a little bit. And the key performance measures, one thing I'm going to get into a little bit, it's about information needed, but I don't think it should just be financial results. If you get your income statement on a monthly basis and you look at it and you look at the trends, I think that's doing good. But it could be better, and somewhat of this different perspective, and you've got to be able to dive a little bit deeper when you look at the performance measures a little bit. And the two should be married. One shouldn't be absent of the other. And so, for example, when you look at the metrics, you look at revenue location, or you look at revenue by procedure, by payer, by provider. You look at your cash collections and such. All of that information is information that's in your financial reporting. But then you start to use different statistics to say, let me look at it this way. And it allows you to drill down to a level. Philip's going to use the phrase about dimensions and building different things. And it's the same concept of being able to take a financial reporting for whatever period, whether it be month or whether it be a year-to-date period or for a whole fiscal year or calendar year that you report on, to be able then to take that down a level or to two levels. It allows you as a decision maker to see things better and again start to identify issues before they become too big to deal with. So you need to understand what performance measures you should be reviewing. That's very important. Once you've established them, you need to develop a reporting mechanism that gives you those on a consistent basis. We talked about it, even though it seems odd. I've seen people report things not on a consistent basis. And so they might talk about something quarterly, and then the next time they talk about something monthly. The reason you want to do it consistently is it allows you to identify the trends. We keep talking about that, but it allows you to identify those trends so that you can see on a consistent basis what it should be. You kind of start to develop your expectations, and it allows you to identify when something's off. And it is critical that your metrics are driven off the information in the financial results reporting. So again, your income statement, if it's not coming out of your trial balance, your general ledger or whatever to drive these metrics, you could be in a world of hurt. And I know what that means. You've got a system that reports your financial information, and you've got a revenue cycle system that's separate. But you should be able to marry those two to develop the metrics to look at those things, those metrics that you come up with that's best for your organization, and do so in a way that's seamless and that you can rely on, to get the information you need to make your decisions. So even though you'll be connecting two or more systems, it should be possible to allow you to look at it and again to develop the metrics and the ratios that you want to look at. We're talking a little bit about value, and we talked about the ability to be flexible. So just so you know, whatever system you come up with, you're going to have to be able to get these value-driven points out there so that you can start to measure all your financial results based upon value. They're going to become a bigger part of your operations, and so the metrics should be allowed to be modified to include these as well. So my point to that is I would watch for that. Make sure that when they come, you're ready to adapt those. Talk a little bit about the trends. So again, reporting of financial results should be relatively simple and easy, but shouldn't stop there. The development of metrics, it's very important, and it allows you to take your financial results and to go deeper. But the biggest point and the reason that you have those is the ability to identify trends. And you should be able to identify key trends in either refined financial reporting or in your metrics. So again, that idea of kind of turning the organization, the financial reporting around to see different perspective is critical because it allows you to maximize your efforts to manage the organization, because you concentrate on the right trends and you don't go down rabbit holes chasing stuff that you don't need to deal with. So it just gives you a much stronger foundation in order to manage the organization. So here's an example. So revenue location, if you look at it and you have that set up in your financial reporting or in some sort of dashboard, and you see a negative trend for 3 months, you can immediately start to dive in and say, what's going on? You know, our provider schedules. Are there an issue with more no-shows? Did we lose somebody who used to make phone calls to make sure patients showed up? Have we changed our marketing efforts? Are we going through, is the charge capture working right in this space? I'm going to repeat this in a little bit, but everybody on this phone, on this webinar, has limited time. And with all the change that we have coming at us, our time is even more stretched. So any way that you can then use tools to your advantage to allow you to use your time more effectively is going to be beneficial not only for yourself, but for your organization. And so this example, revenue location, you immediately can jump into it and start to look at what's going on. So your efforts put into the right place instead of starting at a different level or higher level within the reporting process. Another one, revenue by procedure decreases. Well, to me, you immediately would start to look at your payer mix. So have we started to change, and all of a sudden we've got a new contract and it's paying us less? We could go in and say, are we getting paid at the rate we are supposed to be getting paid at? And again, we could go back and look at the charge capture. So again, more focused effort where we need to do by identifying a trend and attacking it much faster than if we just rely on one section of just financial reporting without trends, or we try to develop it on our own, because typically then we lose even more time in our efforts to try to fix it. It becomes a bigger issue than what it needs to be. By looking at trends, good financial reporting, reviewing metrics, we can get to these things faster and get a fix out there faster. So my summary, healthcare is a complicated field, and change is coming, and it's increasing in complexity every day. And as I said earlier, no one on this webinar is getting more time handed to you. You're not being told, here's an extra hour to spend in your day for free. So you have to maximize how you allocate those hours. And if you do not have good, sound financial reporting that gives you the right information, that's timely, that's easily adaptable, you're going to have, your job is harder than what it needs to be. You've got to develop metrics to help you. Healthcare demands that you not only look at results, but that you go deeper on the results that stand out to you. And again, these KPI measurements or metric development allows you to do that. You also have to identify trends, and to do that really quickly. Doing so helps you stay ahead of any negative consequences from those trends. And so that's kind of my view of just, my experience in healthcare. And I'm going to hand it over to Philip now, because I think he's going to kind of walk you through some demonstrations on some what this kind of thing might look like.
Right. All right. Thanks, exactly. David. We'll just switch screen. Sorry. Go ahead, Philip. Yeah, there you go. Perfect.
Okay. Thank you. Sorry about that, Yelena. So, David, I appreciate the information that you had in the slides there. That's fantastic. And I think hopefully I can show you how we dovetail into that with a solution like we're going to present today. So I've got 7 slides that I'm going to go through, but I am going to hit them real quick. Won't spend a whole lot of time going through this. I do want to get you into the software for the vast majority of the time, but I think there's a few important key concepts to focus on, least of which is this first slide. I'll summarize it by saying this is me. I am a CPA. I have been working in the accounting software market now for more than 25 years, which every time I think about that, it makes me feel a little bit older, but that's my issue. And I'm just excited to be here today to show you some of the new innovations that have come about in the last couple of years in the way that you can track some of the things that David was talking about. So the system that we're going to take a look at today is called Sage Intacct, and we like this solution. We recommend this solution for a number of different reasons that we're going to talk about. First of all, it is the undisputed leader in innovation. So to do that, Sage Intacct is the only mid-market, which is that market between QuickBooks and something like an Oracle or an SAP, some of the very large players. It's the only solution in the mid-market that puts out 4 new releases a year. Undisputed leader in customer satisfaction. Sage Intacct is consistently ranked #1 on the G2 Crowd website. You can see an award down in the bottom right-hand corner that we earned this summer. G2 Crowd is a user review rating website. You have to authenticate with something like your LinkedIn profile, and you have to take a 20-minute survey. So this is not a fly-by-night review. It's a very well-respected review website. It's built by finance experts for finance professionals, a number of the original founders and a number of the folks that are still on the product management team are CPAs, so they know what they're talking about. It's the first and only preferred provider of the AICPA, and this is one of the things I am the most proud of. AICPA has done exhaustive searches over the years, and they always come back to Sage Intacct as being their only preferred accounting software solution. So again, the folks that wrote the book on accounting choose Sage Intacct, and then the International Federation of Accountants actually run on Sage Intacct. So G2 Crowd, Gartner Group, AICPA, all recognize Sage Intacct as a leader in the financial platform for the mid-market. Now, this screen, what I want to focus on here on this screen is really the last part there to the farther right, is smart connections. So one of the key concepts of Sage Intacct, and one of the things that makes it really stand out from other platforms, is the fact that we build means and methodologies to connect with other systems. So Sage Intacct doesn't try to be the best EMR. Sage Intacct doesn't try to be the best patient management system. They don't try to be the best tax management system, the best expense management system, those things. Sage Intacct wants to be the best core financial system that it can be, and build fantastic means and opportunities for you to integrate with other systems like an existing EMR that you might have, or some other tools that you might use within your organization. The API in Sage Intacct is extremely open. It's very compatible, and it's very easy to learn. We ourselves at Dean Dorton have built a number of integrations from software solutions into Sage Intacct. So connections are available. Now, one of the key concepts, and this is what I kind of really most wanted to go over with these slides, but one of the key concepts of Sage Intacct, and David made mention of this, is the concept of dimensions. If you break it down really to what it is in a traditional accounting software solution, you typically would have a chart of accounts string, and that might be something like 4000-100-20. And maybe you're capturing a main account number, a location, and a department. So you've got that string. What Sage Intacct does is they break it into separate pieces called dimensions. You have, as you can see on the screen here, you have a number of predefined dimensions that are available, things like customers, vendors, employees, locations, departments, classes. You have some that are available through certain modules that you may get. So if you purchase the inventory module, for example, you get the warehouse dimension. If you purchase project accounting, you get the project dimension, and so forth. So there's a number of dimensions. Think, though, of these dimensions as tags that you apply to transactions. So again, you code a transaction into accounts payable, you tag it to a vendor, you might tag it to a location, you may tag it to a legal entity, you might then tag it to a department, to a specialty, to a procedure, to any different number of things that you want to track. So the benefits of the dimensions, as it says up there, are numerous. It doesn't tie it into your chart of account structure. So you've got some freedom there to have a lot of flexibility in your chart of accounts, and you don't have to have a lot of account numbers. The real key is that it carries it all the way down to the general ledger. So it makes your reporting just exponentially greater. So here's an example of how a transaction might look with some dimensions. It's a $1,200 transaction. That's the date of the transaction. That's the GL account number that we hit. And then we get into our dimensions. We say our payer, Tom Jones, our provider, Kyle Reese, our location in South Carolina, our department, operations, our service, home visit, our line of business, patient services. What that gives us then is an ability to run financial reports based off of any of these different dimensional values down here at the bottom. So it really breaks out what we're able to do, or really expands what we're able to do from a financial reporting perspective to meet some of those objectives that David talked about with reporting and being able to really manage the business. So one of the other side effects of this is it handles multi-entity environments extremely well. And I won't get into all of these details, but in 25 plus years of working with accounting software applications, Sage Intacct handles a multi-entity environment better and easier than any other software solution that I've seen. So we work with, dental offices, we work with chiropractic offices, other medical practices, hospitals, and they'll have multiple legal entities. And we utilize that dimensional concept to be able to track those entities better and easier than, again, anything I've seen in 25 plus years. So here's just an example. This is my last slide. This is just an example of how dimensions can be utilized. So we've got, like here, for example, an Oklahoma City location, a Dallas location, and a Bethesda location. But we've also got an Oklahoma grouping, a hierarchy, and then a central region hierarchy or grouping. So we're able to nest these, we're able to take those dimensions and have parent-child relationships between them so that we can not only produce reporting by Oklahoma City versus Bethesda, but we can look at central region profitability, we can look at eastern region profitability, and you can think about this for procedures or specialties as well. So if you're looking at different types of dental procedures, maybe orthodontics versus general dentistry, or if you're looking at different types of eye care, different types of medical care, neurology versus gastroenterology, you can structure this in such a way that you can get lots of different kinds of reporting just based off of one or two dimensional values within your environment. So there's a lot of ways you can twist and turn it. The dimensions are key, and again, they're tags that you apply to your transactions. All right, so we are now logged into Sage Intacct. I skipped the login process, but basically you have a company, a username, and a password, and we can tie single sign-on to it. We can tie multi-factor authentication. We can tie a lot of things to your environment to make it more secure as well. And by the way, we do have full audit trail functionality also, even to the extent potentially that we could meet healthcare requirements as well. So I am logged into Sage Intacct. I am looking at a dashboard, and I'm going to focus mainly on dashboards in the demonstration here to kind of show you more of the after effect and talk about more of the tracking that David talked about during his presentation, as opposed to getting into the nitty-gritty of the application itself. Certainly willing to do that for you at a later date if need be, but I'm going to focus on dashboards. So first, with Sage Intacct, you can create as many dashboards as you want. You can put virtually any object, any piece of data from Sage Intacct on your dashboard. There we go.
Okay, there you go.
All right. Not sure what happened. Okay, so again, you can have as many dashboards in the system as you would like to have, and virtually any object can be placed on a dashboard as well. So what we have here on this particular dashboard, we have a couple of different major topics or major kinds of objects on the dashboard. First, we have performance cards at the top. In the world of Sage Intacct, a performance card is a measurement. How are we doing against? Right? So on the far left here, from a revenue private insurance standpoint, how are we doing this quarter to date versus the prior quarter? How are we doing for public insurance with the same time frame? Revenue, private pay, and then total revenue. Now, how are we getting these numbers? We're using dimensions. So we're using dimensions to capture private insurance, public insurance, or private pay. And we're keying that off of the customer dimension. So we're able then to classify our transactions that we're posting into the system based on the kind of customer that we're working with, whether they're private insurance, public insurance, et cetera. And we're then able to have these performance cards that tell us how we're doing quarter over quarter. If you look right under that, we've got a revenue trend by payer. And here we're giving you some of the details that are behind these performance cards. So not only here's your numbers, but then here's some additional detail and breakdown on those numbers below here as well. If we come down a little bit further, switch gears a little bit right here, profit and loss detail by provider. So we're using another dimension in the system as we post transactions to capture the provider, capturing the physician, the doctor, that's providing this particular service. So we're able to see who's generating the revenue. Here we're looking at revenue by location. Which locations are the most or generating the most revenue for us? We can see right away here that Partners Health Group Holdings is kind of falling behind here. Maybe we need to check with them and see what's going on, or maybe we need to check our numbers and see if perhaps something got miskeyed within the system. Down below, you've got some additional financial reports as well. Profit and loss detail by provider. You see each provider in a column. You see the adjustments write-downs. You see the revenue. You see the travel, meals, and entertainment, etc. You can see all things related to these different providers here. And then we've got a top 10 payers for revenue in the bottom right-hand corner. So there's a lot of things in this dashboard that you could look at and gather information about how healthy your organization is, about trends within your organization. Partners Health Group Holdings is obviously very low on the revenue side here, so we need to figure out what's going on there. Maybe they're brand new. Maybe they haven't been in the organization that long. They just started. Maybe that's normal. Maybe it's not, and we need to investigate. Dashboards in Sage Intacct give you those indicators, give you those keys. Now, on this particular dashboard, there's a couple more things that I want to point out to you. First of all, and these will hold true with all the different dashboards that we look at. First of all, in performance cards, you can quickly and easily see if you're positive, negative, or neutral. And that's done by the green arrows, in some cases green smiley faces, in some cases green thumbs up, or the red frowny face, the red arrow down, or the red thumbs down, okay? So you can get a visual indicator of how well things are going in your performance cards just with these very prominent symbols on the screen. You can also get visual indicators in your financial statements. So not only can we present the financial information to you, but we can make it something that really speaks to you, not something that you have to go digging through, looking for, calling people to try to understand. We can really set the system up to make it speak to you and give you the information. If you were to look at this financial report, for example, there's one spot in here that's not doing as well as the others. And that's this particular quarter-to-quarter number. You can see this first quarter here, we're at 148, second quarter here, 127. And Intacct is giving us this visual cue in red to bring our eyes to it, to say this is an area that we need to take a look at. So Medicare Part A, public insurance, from first to second quarter went down 22,000 or 13.85%. These areas went up, and these areas are plus or minus, a margin of error kind of thing. They're up, they're not green, they're not great, but they are up, they're not down and red. Now, the last thing I'll point out on this particular screen for you is that virtually every spot on these dashboards in Sage Intacct are live, active numbers. So what I mean by that is if I want to say, well, I'm up 248,000 over the prior quarter for public insurance revenue, how could that be? Well, this isn't just a pretty number. If I click on it, it brings up a financial, a very targeted financial that I can look at, and then I can even click on the number in that financial, and that's going to take me to the detailed transactions behind it. And here I'm looking at a general ledger report, and you'll notice that these are blue, therefore these are hyperlinked. I can drill in on these as well, and I can keep going and going and going in this process until I get to the point where I am drilling down into the originating transaction in the system. And this works whether you are keying the transactions into the system, pumping them in there by hand, or whether you are integrating, as I'd said before, from maybe an EMR system of some kind or something else that is at your organization that may be your operational product. Set it up, import in the right level of operational data, and you'll still have these drill backs in the system to get back to some semblance of that originating data. Okay? So all of these are live, all of these can be clicked on, even our charts and graphs. Okay? So that's one example of a dashboard. I'm going to stay here real quick on this one, and I just want to go to the cash analysis dashboard. Cash is king, right? We all want to know what our cash position is. How are we doing on our cash balances within the system? And we want to keep that. We want to track that information. So why not set up a dashboard with a cash balance weekly graph, and we can see steadily trending up. And that's a good thing. We're building up our cash reserves. Our cash is trending up. There's our cash balance this month. We're up $537,000 over the prior month, so we're doing well. Our operating cash flow is up $44,500, and then here's the details of our cash flow statement. So again, you can have a number, an unlimited quantity really, of dashboards within your environment, and you can analyze that information on a regular basis. You can access the information daily. You can refresh the information whenever you want, and it is live, actual data coming from your system. Okay, I'm going to switch tabs here. I've just got a few tabs open at the top just to make changing dashboards a little bit more quick and easy. Here I'm looking at a different kind of dashboard presenting some different types of data. Okay, so before we were looking at some insights, some KPIs, some overall business type information. What I want to show you here is how we really can tailor these dashboards to your type of organization, right? Because healthcare can mean a lot of different things. As you can see here, we've got some samples that we've created for skilled nursing, senior living, behavioral care, dental groups, and then physicians groups as well. And I'll take you through a couple of these. But the same basic principles exist on all of these dashboards. No matter where you're looking or what you're looking at, the same basic principles are true. If I see this number, $6.3 million in revenue, and I want to look at it and determine what the information is behind it, I see it. And I drill into it from here, and I can continue to drill down into this. I will also note that nearly every, and I always hate to say every, but nearly every screen has an Excel button where you can push data out to Excel for further analysis. One of the things I want to really point out to you on this screen that we didn't talk about previously is the fact that Sage Intacct can also track statistical accounts. So if you're looking at number of treatments and you want to find revenue per treatment, you're able to do that. You're able to create a dashboard object that captures that information. You don't have to go digging through piles of reports. You don't have to spend hours in Excel analyzing information. You simply have to design the system properly, which is what we would help you do. You have to record the information into the system, which we can again help you integrate with other systems, or you can key it in. And then you have to just look at your dashboards, right? Look at these objects that you've created. How many physicians do we have? What's our revenue per physician? Right here at your fingertips. You know, how much time do you currently spend right now digging for that information or creating that information? How much time do you spend right now looking for a profit and loss detail by provider? So here I've got 4 providers that I'm focused in on: Derek, Amy, Kristen, and Max. And I can see the profit and loss by these providers in a graph. And of course I can click, I can drill into this information. It's going to give me a pop-up window, and then I can look at all the details behind that. Here's Kristen's P&L statement. how long does it take you right now to put something like that together? Would it be nice just to have it on a dashboard? Let me take one more here. The senior living metrics, and same basic concepts, but just wanted to show it to you from another angle. Here we're tracking occupancy rates at our senior assisted senior living center. We're tracking revenue per unit. And then we've got here, of course, an income statement. And here we're breaking it out by all of our different locations. Now, the one thing I did not show you before that I meant to, and I apologize, is we've got what we call spark lines over here to the far right-hand side. So this is month to date, December 31st, 2018. But this spark line gives me a yearly look at how we've done each year or each month. So we're going up, and then our payroll expenses went down a little bit, and then our payroll expenses went back up a little bit. So if we come down here, for example, to occupancy rate, we kind of held steady, and then we shot up at the end, okay? So these spark lines give you a visual representation of how things are doing over a year period, as opposed to looking at 1 month in particular. So the last place I'll take you, we've looked at dashboards based on wanting to have certain trend information. We've looked at dashboards based on what kind of healthcare you might be in. I want to show you now healthcare based or dashboards based on who you are. Okay, because the CFO is probably going to want to see a little bit different information than an accounting manager. And then we'll kind of wrap it up with this. I love this dashboard. One, because it's got a lot of nice colors on it, shows you a lot of information. But two, it really just does have a lot of things on here that are very specific to what the CFO is going to want to see. So here's your company performance over a year. Revenue, total cost, net income. You're looking at a visual representation here of how your company's done over the year. Here's some more performance cards. We can click on these, we can drill into these, and notice the intelligence is in the system to say if cost of goods sold is up, write-ups, write-downs, if those kinds of things are up, then that's a problem. So yes, it's up, but it's red because that's a bad thing. If your costs are up and they're higher, that's a bad thing. You could kind of go down a little bit here. There's your operating margin trend, right? Operating expense by department. Here's a net income trend. EBITDA trend. Working capital trend. Cash balance trend. Here's your cash on hand performance card, your debt ratio performance card, and your debt ratio trend. So this CFO dashboard has a number of things that any CFO would be looking for. But if we switch over to a controller dashboard, you can notice there's a few different things here. We've got more around G&A expenses. We're more focused on our cash balance. We've got a couple of copies of P&L reports over to the right-hand side. Again, with formatting that shows us how we're doing, versus budget perhaps, how we're doing for one period to another within departments. And then even over here, some of our workflows in the system where we've got the capability to have different approvals within Sage Intacct as well. Okay. So that's kind of what I had. Again, dimensions within Sage Intacct are tremendous drivers of information. Those dimensions can be customized to track what you want to track. Providers, occupancies, different things like that. We can take those dimensions, track what you want to track, and then we can provide you the means to get to dashboards like these where you're able to really see trends in the business at your fingertips. So
awesome. Thanks, Philip.
That's what I had.
Yeah, that's awesome. I'll give everybody some time to type in any questions if anybody had some. I did have a couple that came through, maybe more for David, but one was when setting up a financial reporting template, how do you know exactly what metrics you should use? If you can just touch on that, David.
Yeah. So what I think is important is kind of who do you have to report to, if that makes sense. And so you have to set up the metrics that allows you to summarize your operations in such a way that it'll be easier to communicate it to the decision makers, whether you're the controller or the accounting manager or a CFO. You need to understand who that is, whether it be a section chief or a physician that runs a practice. What are you going to need to show them and be able to communicate it with them clearly? So I hate to say the answer is it depends, but it depends upon the operations and what you have and what you need to report. And so I'd start at the top and then work backwards into what those metrics should be.
Okay. Awesome. Thank you. And this one is a little bit similar, I feel like, but we'll just ask it anyway. Is there any specific data that someone should be looking at on a more regular basis rather than just your monthly reporting, something specific in this healthcare industry since it's always changing?
You know, I talked about in my presentation that you know, we can't avoid the temptation of looking too much at cash or too much at operating results, at looking at both of them. But with the fact that operating results are something that's ongoing, and Philip kind of showed you some live data and the ability to look at that, cash is still important. And so regardless of what you are, or what kind of organization or entity that you are, I would be looking at your cash balances daily, your deposits, because that is kind of a barometer of health, of what's coming in and such. And so that's one clearly I'd look at. Any volume statistics that you might develop in your metrics, I would probably look at those from a standpoint, a daily standpoint, I mean. I used to work with a multi-specialty group, and to me, one of the things I looked at on a daily basis was the waiting room for the radiology, because that gave me an indication of the volume across the practice. And so things like that, just understanding volume, understanding cash, are important on a daily basis and weekly basis. Again, look at it consistently so you understand it, because you will get trends within a month on the collections, but doing that gives you an idea of what you should expect, and those things I'd be looking at on a more regular basis.
Okay, great, thank you.